Hello everyone, this is Dr. Leili Hatami. Welcome to this study guide review for our Asynchronous Anatomy Lab Exam 2. As we progress through the study guide review, please take notes on the key points covered to prepare yourself for the upcoming exam. Let's begin. In the first part of our review session, I will cover the key points of the cardiovascular system. You can expect around 8 multiple choice questions related to this concept. As cardio means heart and vascular means blood vessel, so in this part we are going over the structure of the heart and also some of the important blood vessel. Okay. The first thing that you can see is a picture of the coronal section of the heart, that you can find the 4 chambers. So you should know the internal features of the heart. If you remember, we divided the heart into 4 chambers. There are 2 superior chambers. Each is called atrium. And then we have 2 inferior chambers, which they called ventricles. So it means that these 2 are called atrium and then ventricles. And one more thing, you should know that which side is the right side and which side is the left side of the heart. Look at the apex of the heart. The apex of the heart is pointing to the left side, so it means that this side of the heart would be left side. So it means we have left border of the heart, left atrium, and then left ventricle. And the other side we have right atrium and then right ventricle, or the right border of the heart. Okay, now let's practice. On this picture of the heart, this highlighted part, it shows us the atrium, right? Because it's a superior chamber. So we have atrium. And then you should know, is it right or left? Then look at the apex. So the apex showing us the left side, so that would be the right atrium. So this is the right atrium. The next picture is showing the superior chamber. So one more time, we have atrium, and then because it's going to be on the left side, as the apex is toward the left side, so we have left atrium. And then here we have 2 ventricles. We have right ventricle and then left ventricle. Okay, next, you should know these 4 chambers from the external view of the heart without being caught. So in this one, again, you should find the atrium at the superior part of the heart, and then at the inferior part of the heart we have ventricles. And also it's important to find which side is the right side, which side is the left side. Again, look at the apex. The apex of the heart is pointing to the left side. So it means that this side should be the left side of the heart. And this one is the superior chamber, right? So that would be atrium. Which one? It's right atrium. Okay, so make sure you know this chamber or this part of the heart is highlighted is the right atrium. Next, look at this part. That's gonna be the inferior chamber. Again, this is the apex, the left side, that is the right side. So it means that is highlighted. Part of the heart is right ventricle. Next, you can see 2 view of the heart. On this one, you have the anterior view of the heart, and this is the posterior view of the heart. And you should be able to find which part of the heart is highlighted. Actually, the left atrium is easily visible through the posterior view and a little bit part of it through the anterior view. So then that would be the left atrium. So left atrium from the posterior view, and this is the left atrium from the anterior view. Next, you can see this highlighted part of the heart, which is at the apex region and is the inferior chamber. So simply means that this is a left ventricle. Okay, I hope you can label the heart, the internal feature of the heart and also the external feature of the heart, like these 4 chambers. Okay, next let's go and find some other structures which are important, and these are valves. We have 4 valves in our heart, which closing of these valves is causing the heart sounds. So please make sure the heart sounds caused by closing the valves. But let's see what are these valves. So here you can find the apex. So it means that this is the left side, this one is the right side. And then we have the superior chambers as atrium and then inferior chambers as ventricle. And look at this valve gonna be found between the right atrium and right ventricle. It's called right atrioventricular valve or tricuspid valve, as it has 3 cusps in the structure of this valve. And then in this picture, you can see again, find the apex, find the left side, find the right side, and then find the right atrium, left atrium, the right ventricle, the left ventricle. And what would be the name of this valve? This one is left atrioventricular valve. Next, look at this one. Again, find the left side, at the apex side, and then find the right side. And then here we have the right ventricle. And look at this blood vessel leaving the right ventricle. If you know, the right side of the heart gonna be filled with the deoxygenated blood or blue blood. So it means that through the right atrium, the heart is going to receive the deoxygenated blood from all parts of the body via the superior vena cava, inferior vena cava, and coronary sinus. And then from the right atrium, this blood goes to the right ventricle. So it means that in the right ventricle, we have blue blood or deoxygenated blood. Guess what should happen? We are going to send this deoxygenated blood to the lung because we want to exchange the gases between blood and air in the lung and refresh this blood. So what would be the name of this blood vessel here leaving the right ventricle toward the lung? So it means there is a blood vessel between the right ventricle and lung. We call this blood vessel as the pulmonary trunk. As pulmono means lung. So the pulmonary trunk is carrying the oxygenated blood from right ventricle to the lung. Okay, so what would be the name of this valve? We call this valve as pulmonary valve. Pulmonary valve gonna be found between the right ventricle and the pulmonary trunk. Okay, next one, look at this. Actually, this is the largest blood vessel in our body, and it's coming from the left ventricle. So again, we should know that this side is the left ventricle, as the left atrium is going to receive oxygenated blood from the lung. So then it's going to send this oxygenated blood or red blood from the left atrium to the left ventricle. It means that in left ventricle, we have red blood or oxygenated blood. And then we are going to send this oxygenated blood through the whole body, the entire body. So what would be the name of this blood vessel leaving the left ventricle? That is aorta. So it means that between the left ventricle and the whole body, we have aorta. Okay. And then there is a valve between the left ventricle and the aorta. What would be the name of this valve? That would be the aortic valve. Easy peasy, right? Okay, so let's review. Do not forget the heart sounds is because of the closing of the valves, and then there are 4 valves in our heart. 2 gonna be between the atrium and ventricle, and 2 other gonna be between the ventricles and the blood vessel leaving them. So we have right atrioventricular valve between the right atrium and right ventricle, and there is left atrioventricular valve or bicuspid valve between the left atrium and left ventricle, and then we have the pulmonary valve between the right ventricle and pulmonary trunk, and there is aortic valve between the left ventricle and then the aorta. Let's go over some other features of the heart, the internal features of the heart. So here again, we can see the superior chambers, and this is atrium, right? So we have atrium, and this one also is atrium. This is the apex, so it means that this is the left side, this side is the right side. So we have right atrium, left atrium. And look at this wall. This wall is between the atria, right? So we are going to call this septum or wall as interatrial septum. Septum means wall, and atrial is related to the atrium, and inter means between. So it means that this is a wall between the atrium, the right atrium and the left atrium. It's easily distinguishable. Okay, next feature of the heart, you should know which one is the interventricular septum. So I can highlight this part. So look at this wall, which literally gonna be found between the right ventricle and left ventricle, is called interventricular septum. So this is a right ventricle, and then the other side we have left ventricle, and this wall is called interventricular septum. This septum or walls actually doesn't let the blood from the right atrium to be kind of mixed with the blood in the left atrium, and also the blood from right ventricle to the blood to the left ventricle. This is not going to happen because of these valve that we have between the atrium and also ventricles. Okay. Okay, what about this structure? So as you can see one more time, this structure is between the left atrium and left ventricle. So that is the left atrioventricular valve. Next, you can see this structure from the external view of the heart. This is an anterior view of the heart. And this one is the posterior view of the heart. This structure is called coronary sulcus. So here, this highlighted structure is coronary sulcus. What is the sulcus? Sulcus is actually a groove. It's a surface groove that you can find surrounding the heart, and it marks junction between the atrium and ventricle. So we know this is the atrium, this part is ventricle. So as you can see, it's going to surround the heart, the anterior and also the posterior. And what is important about the coronary sulcus is that it contains the coronary arteries. That's the reason they call this as the coronary sulcus. The coronary arteries are the arteries which they are going to supply the heart itself. And also the coronary sinus, which is the kind of the vein which is going to collect the oxygenated blood from the heart, going to be found on the posterior view of the coronary sulcus. Okay, next you can see this highlighted area of the heart. We call this as trabeculae carni. Trabeculae carni. Trabeculae carni are the irregular muscular elevation on internal surface of both ventricles. The trabecular carni only going to be found in ventricles. Okay. Next, let's move on to some blood vessels related to the heart. So you can see this picture of the human cadaver, the thoracic cavity. That is the heart, which is sitting top to the diaphragm. So this is diaphragm. Okay, so we can see the heart. Here we have the lungs, and as you can see, the heart is like a triangular shaped structure, which the base of this triangle is and on the top side, and then the apex is going to be at the bottom side. On the base part of the heart, you can find these major blood vessels. Let's name this one, which it's going to be the most anterior blood vessel of the heart. You can find the base side of the heart. So that is pulmonary trunk. Pulmonary trunk, as I mentioned before, it's leaving the right ventricle and going toward the lung, and it's going to carry deoxygenated blood. Next, look at this one, or let's go over this picture at first. So here you can see this kind of large blood vessel. It's actually the aorta. So aorta is leaving the left ventricle, then going up, making an arch, and then going down. So we can divide the aorta into the three parts: ascending aorta, aortic arch, and then descending aorta. In this picture of the heart located in the thoracic cavity, you should be able to label these parts. So as you can see, this is the first part of the aorta, which is going up. So that is the ascending aorta. And then this part, which is the arch of the aorta, it's called aortic arch, which at the aortic arch, you can find these three branches from the left. Sorry, this is actually from the right. This is my right side. This is the left side of my cadaver or picture. This is the right side. From the right to the left, the first one is right brachiocephalic trunk. The second one is the left common carotid. And then the last one is the left subclavian. These are the three branches of the aortic arch. Okay. Now you should be able to label these blood vessels. In this picture, you can see this highlighted vessel is the left brachiocephalic vein. How do we know it's left or right? Again, look at the heart. This is the apex, so it means this side, it should be the left side. Or as we have a rule, this is my right side. So this is the left side of my patient, my model, cadaver, or picture. So that is the left side. This side is the right side, okay? And look at this. So again, let's review it. The first one from the left side is pulmonary trunk, leaving the right ventricle. And this one is aorta. The first part of aorta is ascending aorta, leaving the left ventricle. And this one is the superior vena cava, which is going to carry the deoxygenated blood from the head and neck to the right atrium. The superior vena cava are going to be made by these two veins: right brachiocephalic vein and left brachiocephalic vein. So this is left brachio, which means arm. Cephalic means head. It's going to carry the blood, the deoxygenated blood from the arm and also the head. So it means this vein is coming from the arm, it's left subclavian vein, and this one which coming from the head and neck is the left jugular vein. So we have jugular vein, subclavian vein, join together and make the brachiocephalic vein. So this is a right brachiocephalic vein. We discussed about the brachiocephalic trunk before. Do you remember? That is the artery which is the branches of the aortic arch. So one more time, the aortic arch, the brachiocephalic trunk, the left common carotid artery, and then the left subclavian arteries. And now here we have the left brachiocephalic vein here and the right brachiocephalic vein here, join together and make the superior vena cava as we see. So in this picture, you have the SVC or the superior vena cava. Let me just write it down. We have the superior vena cava, which the superior vena cava is a large vein. It's going to receive the oxygenated blood from the right head and neck and arm, and also from the left head and neck and arm through these two right and left brachiocephalic veins. Okay, what is it? Let's find this blood vessel, which you can see it is a branches of this one. In this picture, you can see they removed the heart and also they cut some of these blood vessels, but you are able to find this blood vessel as it's like an arch shape. So that is the aortic arch, right? Because we actually divided the aorta to three parts: ascending aorta, the first part, aortic arch, the second part, and then the descending aorta. Aortic arch has three branches. From the right to the left, we have the brachiocephalic trunk. Then next one, we have left common carotid artery. And then last one is left subclavian artery. Okay, and let's find them. So the first one at the right side is the brachiocephalic trunk, and then the middle one is left common carotid artery. But how about this one? This highlighted blood vessel, which is going toward the arm, and it is the branches of the aortic arch, that would be the left subclavian artery. Okay, some other blood vessel that we can find in the neck region. So here in this picture, you can find the common carotid artery. So this one is common carotid artery. If you remember, the common carotid artery of the left common carotid artery is the branches of the aortic arch, but the right common carotid artery is the branches of the brachiocephalic trunk. So what does it mean brachio? It means arm, right? What does it mean the cephalic? It means head. So the brachiocephalic trunk is gonna give these two branches, right common carotid artery, and then right subclavian artery. Okay, and this picture, you can see the common carotid artery. Okay, it's going to be found in the neck region. It's going to give two other branches. So it's exit the thorax, go up in the neck region, and then give these two branches. 1, 2. Okay, so next we have to know the name of these two branches. You can find this one, this highlighted one, which it goes toward the face region, is the external carotid artery. So this one is the external carotid artery. And then the other one, which it goes to the brain, kind of it goes internal to the brain, right? So then we are going to call this as internal carotid artery. So one more time, let's follow this blood vessel, which coming from the brachiocephalic trunk in the right side and coming from the aortic arch at the left side. This is common carotid artery. Then it gives these two branches. One branch, it goes toward the face at the external kind of surface. And then the other one, it goes toward the brain that you can see this picture here. So this one is the internal carotid artery, and then this one is the external carotid artery. Please follow the artery, and based on their way or their roots, you can name them. If they go toward the face, that external carotid artery, it goes to the brain, that is internal carotid artery. And next one is a vein, because the veins are superficial. So this vein, it's called external jugular vein. So we have external jugular vein. It's going to drain the oxygenated blood of the scalp and face, and as you can see, is a subcutaneous vessel, is a superficial vessel. We can find it under the skin, and it's going to be formed by two veins near the angle of mandible, like here. Okay, and then it descends toward the middle of the clavicle. That is the blood flow in the vein. It's going to drain the oxygenated blood from the scalp, from the face, and then as you can see, it's gonna be made at the near the angle of mandible, and then it descends toward the middle of the clavicle. The reason I'm going to kind of I'm actually the reason I'm explaining their root is because if you know their root, so you easily can distinguish, oh, I know, because this is going to be made at the angle of the mandible and then goes to the third middle of the clavicle. That should be the external jugular vein. Okay, how about this one? So look at this. It's coming from the face, right? Okay, so it's coming from the face and then going down to the internal jugular vein. It's going to be drained to the internal jugular vein. That is the facial vein. Facial vein, as it's going to drain the oxygenated blood from the face. Okay, next one. Next, you can see this blood vessel related to the arm, or going to be found in our arm region. Actually, this is the brachial artery. Brachial artery. It's easy to find it because the brachial means arm, right? This is a brachial artery, and it is the artery which is in continuous of the subclavian artery. So here we have subclavian artery, and then in the armpit region we call this as axillary artery, but when it goes to the arm region, it's going to be called as brachial artery. Let me ask you, what is the name of this artery here? You should know that this is the lateral side of the hand and forearm, as we have thumb on the lateral side. So this is the lateral side, and this side is the medial side. And if you remember, we have two bones in our forearm. The lateral bone is called radius. So then we are going to call this artery as a radial artery. But on the medial side, which is going to be here on the pinky side, medial, we have the ulnar bone, and this artery is called the ulnar artery. So the thumb and pinky, they're gonna be your hint. If the blood vessel gonna be found on the thumb side, that is the left side, it's gonna be toward the radius, so that is radial artery, and this one is the ulnar artery. Next, in the second part of our review session, I will cover the key points of the digestive system, and then you can expect around 8 multiple choice questions related to this concept. Okay, so you can see this model of the digestive system, but before going over the digestive system model and be able to label them, please remember that we can divide the organ of digestive system to the digestive tube, the organ of digestive tube, and also the accessory organs. Digestive tube starts from the oral cavity and ends at the anus here. So you should be able to label all the organs of the digestive tube, starting from the oral cavity and ending at anus. Let's try. So the first part is the oral cavity. Easy, right? And then the food goes to the pharynx. So it means the next part, it's going to be pharynx. So here we have pharynx. And then food's going to be pushed toward the esophagus. So it means the next part of our digestive tube, which going to be found in the neck region, thoracic region, and then it's going to pierces the diaphragm and goes to the abdominal region and reaches to the stomach, that is esophagus. So here, one more time, we have the oral cavity. The next one, so oral cavity, and the next one is pharynx. Here we have pharynx. And then food goes to the esophagus. So here we have esophagus. Okay, and then now we are in the abdominal cavity. The next digestive tube organ is stomach. So we have stomach here, and then after stomach, food goes to the small intestine. So here we have the small intestine. And then after small intestine, which it also has 3 parts, duodenum, jejunum, and ileum, which duodenum is the retroperitoneal organ, which means that it's going to be found behind the peritoneum, the serous membrane of the abdominal organs. So it's kind of a deep organ, so you cannot see the duodenum from this view, but you are able to see the second and also the third part of the intestine, which is going to be jejunum and ileum. And after ileum, we have the large intestine. So this part is the large intestine. Okay. But what about the accessory organs? What are the accessory organs of the digestive system? The accessory organs are tongue, teeth, glands, like we have salivary glands, and liver, gallbladder, and then pancreas. And now let's find those organs. Okay, so we can start from the head region. Here we have this salivary gland, which is the largest salivary gland. It's called parotid salivary gland or parotid gland. And then you can see this salivary gland, which is going to be found under mandible. So we call this as which sub means under, submandibular gland. Okay, and then the other accessory organ is liver, which is the largest gland in our body. And then you can find these two lobes from the anterior view of the liver. So here on anterior view of the liver, there is a falciform ligament which gonna divide the liver to two lobes. So this is my right side. So this is the left side of my picture or model. This is the right side of my picture or model. So we have the right lobe of liver. The right lobe of the liver is very huge part of the liver. So we have right lobe of liver on this side, and then this would be left lobe of liver. And then here you can find the gallbladder. So make sure you know that the liver is responsible to produce the bile. So the organ is going to produce the bile is liver. But gallbladder is only going to store the bile and modify it. It's not involved in producing the bile. So the only organ is producing the bile is liver. Do not forget this. Okay. Next, we have this picture of this intestine, which you should know a little bit in detail. So as I mentioned before, you can find on the left side, the upper left side, jejunum. And then, let me just fix this, the upper left side, and then the lower right side, mostly we can find the ileum. So here we have the ileum. Ileum is mostly on the right side, and then the inferior and right side. Ileum, I-L-E-U-M. And then on the upper and left side, we have jejunum. Jejunum. Okay. And if you look at this picture of the cadaver, still you are able to find the liver here, gallbladder, this is stomach, and then you can find the large intestine, and also this part is the small intestine. So this is the left side, the upper part, it's jejunum, and this lower part and right side, that would be ileum, which is going to be end at the cecum. Okay, and now we are going over the divisions of the large intestine. The first part of large intestine is called cecum. So here we have the cecum, which the appendix is going to be attached to the cecum. So here we have the appendix. So it means appendix, cecum going to be found on the right side. Okay, and then this part of the large intestine is called colon. As you can see, it goes up toward the liver. So we call this as ascending or ascending colon. And then this side, it goes from the right side to the left side, or under liver to under spleen. We call this region of the colon as transverse colon, as it goes transversely from right to the left. So transverse colon. And then here we have this part of the large intestine. It goes down, which is called descending colon. Then it goes to the pelvic region and its S shape is called sigmoid colon. So we have sigmoid colon. And then at the end, we have the anal canal. So let me go back to this picture. And now you can find the anal canal here. So that is the anal canal. Okay, so make sure you are able to label the oral cavity, pharynx, esophagus, stomach, small intestine, and there's two other parts of the small intestines which we can see from the anterior view easily, the jejunum and ileum. And then you should know the large intestine, the different divisions of the large intestine like cecum, the ascending colon, transverse colon, descending colon, sigmoid colon, and rectum and anal canal. And then you should be able to label and find the parotid gland, submandibular gland, and also right lobe of liver, left lobe of liver, and also the gallbladder. Okay, so next part we are going over the module 5 respiratory system, and you should expect around 8 multiple choice questions from this concept. This picture you can see from the head and neck region is the sagittal section that you can actually find the nasal cavity. Okay, so the sagittal section of the head and neck. So this region is the nasal cavity, which air goes to the nasal cavity here. Okay, please pay attention. Here we have the oral cavity. So this is oral cavity, okay? The floor of the oral cavity is tongue. So this is actually the tongue. Tongue. And look at the roof of the oral cavity or the floor of the nasal cavity. Here we call this as palate. So let me use the different color. So here we call this as palate. So the palate is the roof of the oral cavity and the floor of the nasal cavity. 2/3 of palate, which is bony, is called hard palate. So here we have nasal cavity, oral cavity. Between nasal cavity and oral cavity, there is palate or hard palate, which is made up of bone, the maxillar bone and palatine bone. Okay, so then after the nasal cavity, air moves to the pharynx region. So the pharynx is this tube which it goes to the back of the it is going to be found back of the nose and then back of the oral cavity and then back of the larynx. So this region is the pharynx region. After pharynx, we have the larynx. On the respiratory tract and esophagus on the digestive tract. Okay, so then what is this highlighted part? Just remember that this is a nasal cavity, the oral cavity. Between nasal cavity and oral cavity, we have hard palate made up of bone. Next, you should know some of these structures here. So as I mentioned before, from this region, back of the nose, back of the oral cavity, and back of the larynx, we have pharynx. So here, we call this region as pharynx. As you can see on this picture, this highlighted, the green part is called the pharynx. If this pharynx part is back to the nose, we call this as nasopharynx. If it's behind the oral cavity, we call this as oropharynx. If it's going to be found behind the larynx, we call this as laryngopharynx. Okay, so that is about the pharynx. What else? Then you can see this structure here. This structure which gonna close the entrance of larynx during swallowing is a cartilage and is part of the larynx. This elastic cartilage is called epiglottis. So make sure you know the epiglottis. So this is the epiglottis that you can see here. And then this region that you can see, it's kind of a cartilaginous region, is the larynx. So you can find the larynx right here. Okay, what is the structure after larynx? So here we have trachea. So it means that this is the nasal cavity, then air moves to the nasopharynx, and then to the oropharynx, and then to the laryngopharynx, and then goes to the larynx and trachea. So it means this region that you can see, this highlighted region, is trachea. Okay, what about the food? So food, it goes to the oral cavity and then to the oropharynx and then to the laryngopharynx. During swallowing, this epiglottis, it's close the entrance of the larynx, then food goes to the esophagus. So here we have esophagus. So it means that esophagus is going to be found posterior to the trachea, or trachea would be found anterior to the esophagus. So make sure you are able to find epiglottis, the larynx region, the trachea, which is going to be found after the larynx, and then behind the trachea we have the esophagus, and also you should be able to find the pharynx. These three regions: nasopharynx, back to the nose, oropharynx, behind the oral cavity, and laryngopharynx, posterior to the larynx. So here again you can see the pharynx, nasopharynx, oropharynx, laryngopharynx, and then if you just continue the laryngopharynx, you are going to find the esophagus. So here we have the esophagus is part of the digestive tract, which is going to be found behind the trachea. Okay, so in this picture you can find the three parts of the pharynx. So this highlighted part is nasopharynx, as going to be found behind the nasal cavity, and it is the part of the respiratory system only. Air only gonna be found in the nasopharynx. Okay, the next part of pharynx which is going to be found behind the oral cavity is called the oropharynx. The oropharynx is going to be shared between the digestive system and respiratory system, as both air and food gonna pass through the oropharynx. This is only air. And then last one, which is gonna be found behind the larynx, is called laryngopharynx, which both air and food gonna pass through the laryngopharynx. Air goes to the trachea after that, and then food goes to the esophagus. Okay, next structure that you should know is the sphenoid sinus. The sphenoid sinus is one of the paranasal sinuses that we have. Para means like around. The paranasal sinuses, it means the sinuses around the nose. So the sinus is a kind of a mucous membrane lined cavity which gonna be filled with air, and then based on their location we have like different paranasal sinuses, and the paranasal sinuses only going to be found in frontal bone. So we are talking about the paranasal sinuses. So as I mentioned before, the sinus is the like a space or mucous membrane line cavity which is going to be filled with the air, and we have them around the nose. There are 4 bones which they have paranasal sinuses: frontal bone, sphenoid bone, the ethmoid bone, and then the maxilla bone. So it means that we have frontal sinus, sphenoid sinus, ethmoid sinus, and maxillary sinus. So in this sagittal section of the head and neck, you can find the sphenoid sinus. So this is the sphenoid sinus. And in this picture, as you can see, this is a frontal sinus found in the frontal bone. Okay. What else? That is actually the larynx. You should be able to label the structure of the larynx. So larynx is a cartilaginous structure, is a membranous cartilaginous structure made up of 9 cartilages, which 3 of them are paired and 3 of them are single cartilage. Here we have the thyroid cartilage, the largest cartilage in the larynx. Below to the thyroid cartilage, there is cricoid cartilage, and then we have trachea. So these are the tracheal cartilages. But what is this one? This is actually the hyoid bone. So the hyoid bone going to be found above the thyroid cartilage. Okay. Next, so you can see this is our hyoid bone. So below to the hyoid bone, we have this large hyaline cartilage, which is thyroid cartilage. So we have thyroid cartilage here. Next, you can see the cartilage below to the thyroid cartilage, which is cricoid cartilage. So here also you have the epiglottis. You can see a part of the anterior view of the epiglottis, and then we talked about this, the hyoid bone, the thyroid cartilage, and then now we have the cricoid cartilage. And then if you continue the cricoid cartilage here, you can find the trachea. So here we have trachea, and these are the tracheal cartilages. Okay, let's move to the thoracic cavity and find the lungs. So as you can see, the lungs are located in the thoracic cavity. And then you can see how the diaphragm going to be found here between the thoracic cavity and abdominal pelvic cavity, as diaphragm is going to separate these 2 cavities from each other. So here you have this highlighted the part of the highlighted part. It shows the diaphragm. This dome shape and thin muscle, which is the major respiratory muscle. And then you can find these lungs one more time. This is my right side. This is the left side of the cadaver, and this is the right side. And you can see these lungs. This is the right lung and then left lung. What else you should know? The right lung is composed of 3 lobes. We have superior lobe, the middle lobe, and then inferior lobe. And left lung, it has only 2 lobes, the superior and then inferior lobes. So it means on the right side, we should have 2 fissures is dividing the right lung to the 3 lobes, the transverse fissure and oblique fissure. But on the left side, we only have 1 fissure, okay, which is gonna divide the left lung to 2 superior and inferior lobe. So in this picture, this highlighted region, it shows the transverse fissure. Okay, one more time. You can see the transverse fissure of the right lung, and here it's going to be the oblique fissure of the right lung. Okay, so next part we're going over is the reproduction system. The reproduction system, you can expect around 8 multiple choice questions from this concept. And let's see. You should know the pathway of a sperm. What is the organ producing the sperm? That's the testis. So testis, which is the primary organ of the male reproductive system, is responsible to produce the sperm. And then we have to know the ducts which gonna carry the sperm from testis. So if you look at this picture, you can find the testis here, and then the first organ or the first duct which gonna carry the sperm from testis is epididymis. So we have the epididymis here. This is the number 1. And then after epididymis, which you can find it superior and also posterior of the testis, like this. Then there is vas deferens or ductus deferens, which the ductus deferens, it goes upward toward the pelvic cavity behind the urinary bladder. It's gonna be joined by with the seminal vesicle duct, yes, the duct of the seminal vesicle gland, and make the ejaculatory duct. So here it means that the next organ carrying the sperm is ductus deferens, and then we have ejaculatory duct, which you can find it is a very short duct going to be found inside of the prostate gland. And then after ejaculatory duct, we have the urethra, which through urethra also the sperm gonna pass. So urethra in male reproductive system, it's gonna be the duct which gonna carry the sperm, and also as a organ of the urinary system is gonna carry the urine. So it means that the pathway of sperm after testis would be number 1, epididymis. Then after epididymis, it goes to the ductus deferens or vas deferens. After ductus deferens, it goes to the ejaculatory duct. And then last one is urethra. Which, based on the location of the urethra, we can divide it to 3 parts. If the urethra is the part passing through the prostate gland, we call this as prostatic urethra. The shortest part of the urethra which is going to pass through the pelvic of the floor is called membranous urethra. And the longest part of the urethra which is going to pass through the penis is called spongy urethra. Okay, what else you should know? Look at this picture. You should be able to find testis, which it's very simple to find. This is testis. And look at this organ, posterior and superior to the testis. We have the epididymis, which is going to store the sperm and also carry the sperm from testis to the vas deferens or ductus deferens. So this one is ductus deferens. Okay, what else? This is an anterior view that you can also find the vas deferens. So let me label this part. Can you see the testis, which is going to be found inside of the scrotum? So this is testis, and then above and back to the testis, we have the epididymis. So this is epididymis here. And after epididymis, there is ductus deferens or vas deferens, which is one of the components of the spermatic cord. It goes upward to the pelvic cavity. So this is ductus deferens or vas deferens. What else you should know? Okay, so here you can see this highlighted region is one of the glands found related to the male reproductive system, which is prostate gland. So you can find the prostate gland. But how do you know it's prostate gland? Look at this one. This one is bladder, the urinary bladder. Okay. And then from the urinary bladder, you have the urethra. So the first part of urethra passing through the prostate gland. So we call this part of the urethra as prostatic urethra. And this gland or this organ, this structure is prostate gland. Okay, look at this one. What is it? So one more time, this is bladder, right? So we have bladder here, the urinary bladder, and then under urinary bladder, we have prostate gland. Through the prostate gland, we have the urethra passing through the prostate gland, passing through the pelvic floor, and then passing through the penis. But what is it? This highlighted structure is going to be found behind the urinary bladder. Let me bring you back here, and this is a posterior view of the bladder and also the male reproductive system. Posterior to the urinary bladder, you can find this paired gland, which is called seminal vesicle gland. It's kind of a tiny gland, right? But 60 to 70% of the seminal flow is going to be made through this seminal vesicle gland. And then let me bring you back to this picture. Through the sagittal section of the male pelvic cavity. So here we're going to be on the posterior of the urinary bladder, and this gland is the seminal vesicle gland. So this highlighted structure is seminal vesicle gland. Next is urethra. So you should know the urethra, and we actually covered this before. This is a urinary bladder, and then this structure exceeding the urinary bladder is the urethra, which is long in male. It has 3 parts, and this was the prostate gland. So it means that we have the prostatic urethra, the membranous urethra, which is so short, and then the spongy urethra. One more time, you can see this highlighted region as prostatic urethra, the membranous urethra, and then the spongy urethra here. For the female reproductive system, make sure you know the uterus and also the 3 regions of the uterus. So in this picture, this highlighted structure is showing you the uterus. So that is the sagittal section of the female pelvic cavity. You can find the urinary bladder here. So this is urinary bladder. Okay. And then back we have the rectum and anal canal, and between you can find the uterus. So here you have the uterus. We are going to define 3 parts for the uterus. So here we have the fundus of the uterus, the upper part of the uterus, and then you can see the body of the uterus here, and in this picture is the cervix. Next, you should know the layer of the uterine wall. So as you already know, the uterus is a hollow organ, which means we can define space or cavity inside, which is called the lumen. And then we can define a wall for this hollow organ. The wall of the uterus is made up of 3 layers. So the innermost layer is called endometrium. The middle one is called myometrium, and then the outer one is perimetrium. So make sure you know this layer of the uterine wall by order from innermost to outermost. We have endometrium. So endo means inside. Myometrium, myo means muscle, as the middle layer of the uterine wall is made up of a smooth muscle, and then the outermost layer is perimetrium. Okay, so then you should know about the uterine wall, uterine tube, or oviduct or fallopian tube. The uterine tube is coming from the uterus, so we have pair of this uterine tube, and it goes very close to the ovary. There is no physical attachment between the ovary and uterine tube. But what is the function of the uterine tube? Actually, the uterine tube is the fertilization location, is the place where the sperm and egg, they meet each other here, and then there is a possibility that they can fertilize, the sperm can fertilize the oocyte or the egg, and then so it means that the fertilization location, that would be the uterine tube. What else you should know? Their epithelial tissue lining the uterine tube is simple ciliated columnar epithelium, as you can see here. So make sure you know the 3 layers of the uterine wall. From innermost to outermost, we have endometrium, myometrium, and perimetrium. Fertilization location is the uterine tube, and then the epithelial tissue lining the uterine tube is simple ciliated columnar epithelium. And then in this picture, which is the sagittal section of the female pelvic cavity, you can see the uterus here, and then this egg-shaped structure is the ovary. And in this picture, this highlighted structure, it shows vagina. Okay, and good luck to you guys. Thank you for watching. If you have any question, please send me an email. Thank you.